Hi, I'm Dr. Jessica Pempek, and I'm an assistant professor and animal welfare specialist at The Ohio State University. Do you have a calf with gastrointestinal disease? What should you do? A health assessment. But how? To get the best health assessment, 3 factors need to be taken into account: diarrhea, dehydration, and fever. To start, diarrhea will be our first factor to assess. Calves can develop diarrhea due to protozoa, bacteria, viruses, and changes to or potential problems with nutrition. In fact, most diarrhea cases are not caused by bacteria, which means a particular calf may not benefit from receiving an antibiotic. Calves with diarrhea become dehydrated very quickly. Fluid therapy in diarrhea cases via oral electrolytes or other fluids is a crucial intervention. It is important to remember not to mix milk with electrolytes, as this might actually make the diarrhea case worse. Instead, give the electrolytes in between milk feedings. As a rule of thumb, electrolytes should be provided at least 2 hours after or 30 minutes before a milk feeding. Having a diarrhea scoring protocol in place promotes consistent treatment decisions. Now let's walk through a couple examples of fecal scoring. A fecal score of 0 is when the feces is in clumps. A fecal score of 1 is when the feces is a little bit looser in pudding-like consistency, but still holds together. A fecal score of 2 is when the feces is in a syrup-like consistency. A fecal score of 3 is when the feces is the consistency of water. Fecal scores of 2 or 3 are causes for concern. Other causes for concern in calves that have diarrhea are depression, a change in attitude, or if they have a fever. Depressed calves can be characterized by a negative change in attitude, alertness, or even feeding behavior. Next, we'll assess dehydration. Dehydration is a major factor in a health assessment. The most accurate way to test if your calf is dehydrated is by tenting the skin or looking at their eyes to tell if they're sunken. To tent a calf's skin, you pinch a fold of skin on the neck, pull it up, and rotate it 90 degrees. Then you count the number of seconds it takes the skin to flatten and return to normal. The skin of a hydrated calf will flatten in less than 2 seconds, and if it stays tented any longer, this calf is dehydrated. Now let's walk through a couple examples of how to skin tent a calf and check for sunken eyes. A score of 0 is when the skin tents less than 2 seconds, the calf is bright, alert, gets up quickly, and this is considered normal. A score of 1 is considered when the skin tents 2 to 4 seconds, a calf might be slow to get up, they may have droopy ears, and this is considered slight dehydration. A score of 2 is when the skin takes 5 to 10 seconds to flatten, the eyes might be sunken, and this is considered moderate dehydration. A score of 3 is when the skin takes longer than 10 seconds to flatten, the calf may be down or unresponsive and have very sunken eyes. This would be considered severe dehydration. A score of 1, 2, or 3 are causes of concern, with scores of 2 and 3 being of most concern. Finally, rectal temperature plays a key role in any health assessment. Sometimes calves get fevers, which is an increase in core body temperature because they are trying to fight off an infection. However, sometimes fevers can cause calves to go off feed and result in performance losses. A normal body temperature in a young calf is between 101.5 to 103 degrees Fahrenheit. A calf that has a fever will have a rectal body temperature of 103 or greater. However, on very sunny days, the ambient temperature might increase the calf's core body temperature a few degrees above 103 degrees Fahrenheit. However, in this case, a calf is still considered healthy. If it is very hot out, mornings are typically the best time to take the calf's temperature. Here are a few key practices to keep in mind when taking your calf's temperature. The core body temperature of a calf can change throughout the disease process, so taking the temperature just one time might not be enough. The best practice is considered taking your calf's temperature at the same time over multiple days. If your calf defecates during the time that you're trying to take their temperature, try it again. Air in the rectum might influence the temperature reading. To get the most accurate reading, the best place to put the thermometer is against the calf's rectal wall. Rectal temperature is a vital tool to getting the best and most accurate health assessment for your calf. When assessing your calves for gastrointestinal disease, it is important to capture the whole picture. Assess your calf for diarrhea, dehydration, and fever before making any treatment decisions. Okay, so now what? Should you treat or should you monitor? Check out our decision tree treatment protocols for more information. Thank you for watching.